All right, you can't get lung cancer questions wrong if you want to pass step 1 and get a 260 on step 2. A 62-year-old male with a 45-pack-year smoking history presents to his PCP with a 3-month history of persistent cough, occasional hemoptysis, and progressive weakness. On review of systems, he reports increased fatigue and some weight gain. On exam, blood pressure is high, 148/88, heart rate's totally fine. Physical exam shows multiple ecchymoses. What are ecchymoses? That's just the medical term for bruise. CT scan shows a 4-centimeter central hilar mass with early mediastinal involvement. That doesn't sound good. Sodium is elevated at 151, potassium is low at 2.9, bicarb is high at 32, and glucose is also high. Which of the following is most likely associated with this patient's underlying malignancy? So this is an enormous mass in this patient's lung, and he has all these different symptoms. Do you know what the diagnosis is? This is going after small cell lung cancer. Small cell lung cancer does some weird things, and in this patient, it's clearly causing Cushing syndrome, which is excess cortisol. And do you know which hormone is secreted by small cell lung cancer? That's going to be ACTH. It's not cortisol, it's ACTH. And when ACTH is increased, it acts on the adrenal gland and pumps up the cortisol production, causing Cushing syndrome. And you may be wondering, why is the sodium high and the potassium low? That looks like aldosterone stuff. And you're right, it is. So when cortisol is really, really high, what you need to know is that it can act on aldosterone receptors, causing this high sodium, low potassium picture that we always see in hyperaldosteronism. And when we have high aldosterone, this will also cause a metabolic alkalosis, because what does aldosterone do to hydrogen in the kidney? It dumps it in the urine, so it brings up our bicarb and brings up our pH. Glucose is also high because cortisol jacks up our sugars. It causes poor wound healing, causing the ecchymoses here, and it also raises our blood pressure. All right, antibodies to postsynaptic acetylcholine receptors. This is going after myasthenia gravis. And there's one high yield associated finding you need to know with myasthenia gravis. Do you know what that is? That's going to be a thymoma. So an anterior mediastinal mass. And do you know how we treat that? We literally just remove the thymoma and it will get rid of the myasthenia gravis a lot of the time. All right, PTHrP. I'm going to give you a little test taking tip. If you see calcium on your test of like 15, 14, anything crazy like that, the answer is probably some type of cancer, but it is not increased in small cell lung cancer. This isn't correct. Prior occupational exposure to asbestos. This can clearly cause asbestosis. It can cause bronchogenic carcinoma and it can cause mesothelioma. If it causes cancer, it's probably going to be bronchogenic carcinoma, and the pneumoconiosis, that will end up causing asbestosis. And the difference between asbestosis and mesothelioma is that mesothelioma is literally a cancer. So weight loss, fatigue, night sweats, etc. Whereas asbestosis is kind of like a restrictive lung disease. This patient's diagnosis of small cell lung cancer has nothing to do with asbestos. Elevated urinary 5-HIAA. This is just a breakdown product of serotonin, and it's released in a couple different types of cancers. But the lung cancer that you need to know for this is bronchial carcinoid tumor. And this is a diagnosis that gets overlooked a lot on step 2 exams. And the main thing I want you to look out for is a really young person with lung cancer. I'm talking like 20, 30-year-old, etc. It's going to be a super young age where you're like, this is really weird. Why do I see a 4-centimeter mass inside this 20-year-old's lungs? It's probably bronchial carcinoid tumor. And it doesn't often actually cause carcinoid syndrome. What it usually causes is mass effect, meaning it just gets really big and causes obstruction. It actually has a really good prognosis in kids. But if you have a young person with a lung cancer, it's probably bronchial carcinoid tumor. And then finally, we get to the correct answer, autoantibodies to voltage-gated calcium channels. This is associated with small cell lung cancer. This is Lambert-Eaton syndrome. And these voltage-gated calcium channels, if they ask you, they're on the presynaptic neuron, not the postsynaptic. Postsynaptic is for myasthenia gravis. Presynaptic is for Lambert-Eaton. So short recap, myasthenia gravis equals thymoma, small cell lung cancer equals Lambert-Eaton. Don't mix those up. There are 2 other things that small cell lung cancer can cause. That's SIADH, and it can also cause really weird autoantibodies to your neurons. And those are called anti-Hu and anti-Yo antibodies. Yes, this is tested. Answer is E.